Well, we're here with Dr. Riopelle, a medical doctor, and Dr. Riopelle, how are you today?
Just fine. How are you?
Good. Dr. Riopelle, you got yourself a hyperbaric chamber lately. I know you do lots of dermatology work and stuff like that. Tell me what the hyperbaric chamber is for and what are you going to use it for?
Well, the hyperbaric chamber is perfect for improving wound healing and making things look better when they heal. We obtained it primarily for using it after procedures. We place patients in the hyperbaric chamber, and as a result of the hyperbaric oxygen in the chamber, the wound area or the area that we treated, worked on, whether it be the face or somewhere on the body, gets a higher level of oxygen and oxygen at a higher pressure, and as a result, it improves the healing, which in turn helps improve the eventual outcome of the procedure.
Okay. How does the hyperbaric chamber work? What's the basic principle of it, how it works?
Well, it's supplying a higher level of oxygen to the body under pressure. And by so doing, it can improve, as I say, the oxygenation at the tissue site. So whatever area needs healing or improving, that area will be getting higher levels of oxygen. Normally, we carry just a certain amount of oxygen in our bloodstream, but if we can get a higher level of oxygen to that area to provide better, it provides better healing. It makes the wound heal faster, or whatever it is we're trying to improve more quickly and in a better way, because oxygen is a healer of tissue.
Right. So basically, because of higher pressure, I mean, when oxygen is put under pressure, it basically liquefies, because that's how we get the fuzz in the Coca-Cola can, right?
Right.
And so as you liquefy as the oxygen gets liquefied because it's under pressure, so it goes into the bloodstream easier and then reaches the areas of whatever, the whole body, I guess, more easily. Is that what it is?
Yes, that's one way to think of it.
Okay. Well, wonderful. So basically, if a person has like a scarred face, a freshly scarred face, for whatever reason, that maybe pimples, lots of pimples, do you think it would help for that?
Well, it could. It's not specifically FDA approved for that type of a purpose. But again, any place, logically, one would think that any place that something needs healing or improving or functioning better, it may improve the opportunity to work in that area.
Oh, wonderful. So you're using it when you do dermatology procedures because obviously that makes and has already some open wounds. So by putting the person in it afterwards, it will make the healing process faster. That's what you're saying?
Faster and better, and if there's any difficulty healing, it can help get one over the hump to heal that area. It's also used by many athletes, including a number of well-known pro athletes, for healing injury and just for improving their overall sense of well-being after a football game. There's one fairly famous football player who uses it every day. He gets in his hyperbaric chamber, he does his own. He's able to get in it every day, and it helps him recover from whatever trauma he's had that day, whatever exercise he's done. He feels it just helps him in healing his body more quickly and better, and keeping it at a very high athletic level.
Great. Wow. So, well, it makes sense, of course. I mean, after all, after a couple, 2, 3 or whatever minutes without oxygen, life becomes miserable, I heard. And so if one gets better oxygen, that just can help. For instance, like I used to and still do go skiing. So if I go up to a 12,000 feet mountain, you can feel there's less oxygen and you automatically have less energy. So I guess if your organs get more oxygen, that should be, the other way around, right?
Yes. I mean, this is not an FDA-approved treatment for that specific purpose, but logically in thinking that through, that seems like a logical conclusion. There's also a well-known group in the United States who uses the oxygen on football players who used to play in the NFL who had traumatic brain injury and post-traumatic stress disorder. And as a result, many of these football players have dementia. Now, this group is currently doing a major study using NFL players and putting them in a hyperbaric chamber and looking to conclude that the hyperbaric oxygen helps with dementia by helping heal in the brain cells. And again, it's not FDA approved for that purpose yet, but studies are ongoing in that direction.
I got it. Well, absolutely incredible. I appreciate you filling us in a little bit on that, and I'm sure we'll talk more about it in some other interviews. Bye-bye, Dr. Riopelle.
Goodbye.